Hi, this is Meldita and I'm back. And this is coronary artery disease when plaque was born. The other name is atherosclerosis. And if you want a shortcut, just say CAD. On my left side is an artery, and on the right is a vein. On the left side, this is an artery that has 3 layers. The innermost layer is the tunica intima, and that is covered by endothelium. That is covered by endothelium here. Tunica intima, endothelium covering it. Next is the smooth muscle cells. The outermost part is the adventitia. Okay? The vein has also an outermost part, adventitia. That is the muscle cell, the media. And this is the intima. It is also covered by endothelium. But if you notice, the smooth muscles are thinner, and this one is thicker. Okay, and also covered by endothelium. That is also covered by endothelium. This is an artery. Okay, this is the lumen. We have also the 3 layers, and you notice this is a fatty streak. They say that at age 20, some people have fatty streak. But if you don't have the risk factors, and if you have a good coronary artery circulation, that fatty streak will actually regress. But not all people have it. Okay. But if that fatty streak continues, that's because you have some risk factors involved. Okay. So what happens if you have a healthy endothelium? First, you have a good coronary circulation. This is my drawing. And to have a good coronary circulation, these are the major arteries. One on the right, on the left that divides into 2. These are your coronary circulation that support your heart muscle with blood. Okay. A good coronary blood flow means you have a continuous, smooth, or laminar parallel flow. So if you have good coronaries, you have also good normal endothelium. The endothelium is very important because it produces very important elements. So, antithrombotic. That means the endothelium will produce heparan sulfate, thrombomodulin, and we have also plasminogen activators. They all prevent the endothelium from having clots. Fibrinolytic means if there are small clots new, then they will be dissolved by the elements I mentioned. There are also elements produced by the endothelium that cause vasodilation. These are the nitric oxide and also the prostacyclin. And the smooth muscle benefits from these elements for its vasodilation. Anti-inflammatory. A healthy endothelium will produce antioxidant enzyme that helps fight autoradicals, especially by smoking. So what if I don't have this modifiable risk factors? I have good coronaries, but I have genetic or family history. There's a chance for you to have coronary artery disease, but it will be faster if you have the risk factors here. These are modifiable risk factors, meaning they could be changed. You know, like diabetes, you can do something about it. High cholesterol or smoking, you can quit. And so with high blood pressure. So they are modifiables. You have the ability to change these risk factors by doing healthy lifestyles. Okay, what's going to happen if you have an abnormal endothelium? Then you are prone to plaque formation. First, if you have these risk factors here, modifiable risk factors, high blood sugar or insulin resistance, high bad cholesterol, LDL, low density lipoprotein, high blood pressure, and smoking that gives off bad autoradicals, then you're gonna break the seal. Our seal here is our endothelium. So this is endothelium inside. It covers the tunica intima, and that is one we're talking about as the barrier or the seal of the intima, the endothelium. So frequent irritation and inflammation brought by high sugar, bad cholesterol, smoking, high blood pressure, then we will break the seal here, the endothelium. So this is the lumen. This is the endothelium, the barrier or the seal of the intima. Underneath is your intima, and this is your tunica media where your smooth muscle cells are. So once this gets irritated or inflamed, then the seal is broken. There is a cell adhesion molecule created by this endothelium will become bad now. It used to be good when everything is good. When things go bad, then the endothelium will also becomes bad. And it produces cell adhesion molecule. And the monocyte, which is one kind of white cell count, will adhere to this adhesion molecule to get in. The LDL, or the low density lipoprotein, will get in as well. Okay, so they get in. The monocyte gets in. It turns to become macrophage. The LDL that gets in will be modified through oxidation and exposed to the inflammatory cells and also the glycation. So this monocyte that gets in become macrophage, take in or swallow these LDLs, and it will continue swallowing it until it will become foam cells. So the inflammatory cells like chemokines that is elicited by these T lymphocytes will also encourage migration of the smooth cells to come out of the tunica media to join the plaque, so it gets bigger. The macrophage will never stop eating or ingesting all these LDLs until it becomes a foam cells, it dies, but the lipids will continue to accumulate, and so with the smooth cells. Okay. Also, the LDL will remain in here because the extracellular matrix surrounding the smooth cells will trap them. Also, this matrix from this intima will trap this LDL, and there's no way out. Now, the glycation takes part too by making all this modified LDL to be antigenic and inflammatory. So once the plaque is born, inflammation will continue. It will never stop from there because I said it's inflammatory, it's antigenic, and that's bad. Okay, so going upward here, yes, this is a normal coronary artery. You don't see any plaque. The second one, you see a plaque forming, fatty streak to a plaque. Okay, here, it's forming. So this is semi-side view picture. The next one here are two. So this is a stable plaque in here. So you see the plaque in here, it's stable, it's still away from the intima. But here on my right side, it's bigger and it's close to the intima. So this is vulnerable, easy to break. And this one is still far away because there's still a distance here. But this one is at risk already. So you might be having on and off or waxing waning pain from this kind of plaque. Okay, as the plaque continues because of your lifestyle, your modifiable risk factors continue. This is what's going to happen. The plaque grows bigger until it hits the intima. It breaks the intima, bleeding starts, and now many blood in here, clots and everything, it plugs the hole. So this could be probably a non-STEMI. This could be your STEMI, but only angiogram will show how far or the degree of the blockages in here. So if they could see the